Anemia is a condition in which the hemoglobin concentration of blood is lower than normal for a person's age and sex. Because hemoglobin carries oxygen, anemia reduces the oxygen-carrying capacity of blood. As a result, tissues receive less oxygen, leading to fatigue and weakness. Anemia is defined as decrease in circulating red blood cell mass. It is characterized by decrease of hemoglobin concentration or RBC count or hematocrit below normal for the patient's age, sex, and altitude of residence. Normal adult hemoglobin level is in the range of 13 to 17 grams per deciliter in males and 12 to 15 grams per deciliter in females. In adults, hemoglobin less than 13 grams per deciliter in males and less than 12 grams per deciliter in females is generally considered anemia. Anemia may be classified based on the morphology of red cells, that is morphological classification, and based on the etiology or cause of anemia. First is morphological classification. This is based on the size and color of red blood cells. It classifies in three types. First, microcytic hyperchromic anemia. Micro means small and hypo means less. In this type, red blood cells are small and contain less hemoglobin. In this mean corpuscular volume is reduced. Common causes include thalassemia, anemia of chronic disease, iron deficiency anemia, lead poisoning, and sideroblastic anemia. This all remember by mnemonic tales. Second, normocytic normochromic anemia. Here, the red blood cells are normal in size and color, but their number is reduced. That's why there is normal MCV. Causes include acute blood loss, chronic diseases, hemolytic anemias, bone marrow failure, and aplastic anemia. Third, macrocytic anemia. In macrocytic anemia, red blood cells become abnormally large. Increase in size and MCV is increased, usually caused by vitamin B12 deficiency or folic acid deficiency. This is also called megaloblastic anemia. Anemia can also be classified according to cause. That is etiological classification. First, anemia due to increased blood loss, due to acute or chronic bleeding. Examples: trauma, gastrointestinal bleeding, heavy menstrual bleeding. 2. Anemias due to impaired red cell production, when bone marrow cannot produce enough normal red blood cells. This type of anemia subdivides in cytoplasmic maturation defects. Examples: iron deficiency anemia and thalassemia. Nuclear maturation defects. Example is megaloblastic anemia. Defect in stem cell proliferation and differentiation. Anemia of chronic disorders. Examples: aplastic anemia and pure red cell aplasia. Bone marrow infiltration and congenital anemia. 3. Increased RBC destruction, also called hemolytic anemia. Here, red blood cells are destroyed faster than normal. Examples: malaria, sickle cell anemia, autoimmune hemolytic anemia. Clinical features of anemia. Symptoms. They depend on speed of onset of anemia, severity of anemia, age of the patient, and underlying illness. General clinical features are either due to tissue hypoxia or compensatory mechanisms. Due to tissue hypoxia, nonspecific symptoms: weakness, malaise, lassitude, and easy fatigability. Dyspnea on mild exertion, angina, intermittent claudication, transient cerebral ischemia. Central nervous system: headache, vertigo, tinnitus, dizziness, syncope, irritability, sleep disturbances, and lack of concentration. Gastrointestinal tract: anorexia, indigestion, nausea, bowel disturbances. Female genital tract: amenorrhea, polymenorrhea. Due to compensatory mechanisms. Cardiac features: dyspnea on mild exertion, palpitation, tachycardia, and congestive cardiac failure. In severe anemia, patients may even experience chest pain or fainting. Signs. On examination, several important signs may be seen. General signs. Pallor. It's the most common and characteristic sign, which may be seen in the mucous membranes, conjunctivae, and skin. Pulse. Tachycardia, wide pulse pressure. Cardiovascular system. Hyperdynamic precordium ejection systolic murmur, best heard over the pulmonary area, cardiac dilatation, and later, signs of cardiac failure. Ankle edema. Important history taking. When taking history in anemia, always ask these important questions. Dietary history. Ask about poor nutrition, vegetarian diet, or vitamin deficiency. Blood loss history. Ask for black stools, vomiting blood, heavy menstrual bleeding, trauma. Chronic disease history. Look for kidney disease, tuberculosis, cancer, chronic infection. Family history. Important in hereditary anemia like thalassemia or sickle cell disease. Drug and exposure history. Some drugs and toxins can cause hemolysis or bone marrow suppression. Signs suggesting etiology of anemia are specific in different type of anemia that we will discuss in next session of specific anemia. Subscribe for more simplified medicine topics, case discussions, and rapid clinical revision videos.